that kind of effort that was required to maintain that stream of income was cut off, and that required an adjustment in lifestyle. And that was a little intense for the family for a year or two.
How a person responds emotionally to the heart attack can greatly influence the quality of the rest of their life.
How did this event, called the heart attack, influence the person's perception of themselves? It just turns out that self-perception, the ability to go out and live your life again, takes a little time. So there is a transition, there's an adjustment, and we can't belittle that. I have seen people take that adjustment and just take charge of their lives. It's a wonderful experience to see that, and some people do it so well.
Recognizing the signs of a heart attack and getting proper medical help quickly is the most important first step on the road to recovery. The next step, which is dealing with the emotional side effects, is just as crucial if patients are to face the future and take control of their lives.
The advances made in the diagnosis and immediate treatment of a heart attack rivals that of any other medical condition in the past decade.
Research is really exciting. The students who graduate medical school today are doing things that the students who graduated medical school 10 years ago didn't even know about. That's how fast things are moving. And it already is being translated into improved prognosis.
Then improved care begins immediately following the heart attack for the long-term health of the patient. This includes controlling blood pressure, lowering cholesterol, and preventing heart failure.
And we have the tools to do that. We have ACE inhibitors, there's a receptor blocker, we have beta blockers, we know what medications not to use. But it all has to be individualized.
Coming up, we'll find out how medications, medical care, and lifestyle modifications can make up the foundation of the recovery process. Doctors say in order to fully recover from a heart attack, patients need to address all of the ancillary issues of the condition, including depression. Dr. Perry Kritschmar is here to reveal some promising findings in treating this common side effect in this Healthy Minute.
Treating depression in patients who have suffered a heart attack may actually help to reduce subsequent cardiovascular morbidity and even death. Patients suffer a range of emotional issues following a heart attack, from depression to post-traumatic stress disorder. A study at Stanford University shows that not only is depression a result of the attack, but recognizing and providing treatment for depression is another component to full recovery. While there is still some controversy regarding the use of antidepressants in heart attack patients, some experts feel its impact on recovery is encouraging. That's a Healthy Minute. I'm Dr. Perry Kritschmar.
What percentage of people suffering a heart attack survive? Approximately 60%, according to statistics taken from the National Heart, Lung, and Blood Institute. That number is much higher for people who seek immediate help. It takes a multifaceted recovery plan to help make life after a heart attack even better than before. Experts say for the plan to be most effective, it needs the active participation of the patient, their loved ones, and the medical team combined. Once again, here's Carlos Bain.
As we've seen, suffering a heart attack came as a shock, but also served as a wake-up call for Joanne Cameron and Bill Sanders. But once they had come to grips with the reality of having the attack, they needed then to focus on moving forward with their lives. Recovering from the emotional damage left behind from a heart attack can be just as difficult as getting over the physical aspects.
Having the diagnosis of a myocardial infarction and heart attack is a pretty big stress and takes a lot of coping. And not everybody's equipped to handle that sudden change in their own perception.
I was afraid of dying and leaving my 2 young children. That was, I think, the most biggest hurdle I had to get over, is the fear of dying.
When somebody comes back for their visit, it shouldn't just be a blood pressure check, but really, how you doing? What's your activity level? All these things have to be discussed.
Playing a crucial role in this process is the primary care physician. Dr. Jose Rios from Miami, Florida, deals with patients of all ages who are at risk or have suffered a heart attack.
I think a lot of times family members, significant others, spouses are very important in terms of helping these patients make the sort of behavior and lifestyle modifications that they may need to make.
And, as with any other condition, open communication between doctor and patient, along with regular exams, are needed.
Know your body, especially for women. If something doesn't seem right, get medical help immediately. And the other thing I would like to stress is to get yourself a good doctor, one that listens, one who respects you.
Taking an active role in the recovery process also aids in the recovery process.
You don't get over a heart attack in a day, and it takes a while. Then when you can look back and say, gee, I am doing more, and I am feeling better, and I am more in charge. That's a pretty nice thing to be able to say.